My parents were kind of next to healthcare in their jobs after they came to America. My dad worked in the kitchen of a nursing home. So he was providing food for people that were in a nursing home. He did the morning shift and the afternoon shift. So he would leave home at 4 a.m. And then my dad paid for my mom to go back to school, and she ended up becoming a pharmacist. And so she was also involved in healthcare, working at hospitals, prescribing medication to patients, and focused on geriatric patients too. So I think as a kid, I kind of observed both my parents in the healthcare field. What really triggered it for me was an experience I had around my tooth. When I was a kid, probably 12, 13 years old, I had to get a root canal done. But my dad had union benefits, and the benefits didn't have enough coverage to pay for the full root canal. And so that was the first time I experienced what it feels like not to have complete, adequate, comprehensive healthcare. And so what the dentist literally had to do was like do what he could. But once I hit my out-of-pocket maximum, he's like, you have to come back in January when your benefits restart. And so I had to leave the dentist's office with like a half finished tooth and then come back when the year started to do it again. That stuck with me. And then when I eventually went to college, I was like, there has to be a better way than what's happening. And so that's really spurred my interest in thinking about health insurance and healthcare. I'm the Senior Vice President of State Programs for Healthfirst. Healthfirst is the largest nonprofit health plan in New York State. We were started and founded 30 years ago this year, so we're celebrating our 30th anniversary in 1993, and we provide low cost, high quality benefits to all walks of life. People who happen to be on the low income scale, elderly folks, older adults, children. So we provide all types of products, government programs, and also private insurance programs to all New Yorkers. What I do is I run a unit called State Programs. And so that's product and sales for our Medicaid line of business. That's for individuals making below roughly $20,000 a year if they're an individual. And our long-term care line of business, that's for individuals who are they're seniors in the home and they need an aid at the home to help them with activities of daily living, like washing, cooking food, cleaning up the house. And then our commercial line of business, which is people who get the Obamacare plans or small business coverage. I do think my background is unique. There's not a lot of diversity at the upper echelons of many corporations. And so I'm uniquely positioned in being African American, Haitian American, at a high level role. I was a former COO of a for-profit insurance company. Now I'm a senior vice president at this company. So I think that's one perspective. The other thing too is I live in the community I serve. So I spent 18 years in the Bronx. I lived in Soundview. And so it was awesome to be amongst the community that I serve. I would go to the grocery store and I knew there was Healthfirst members in my grocery store. I knew it because we had 40% market share. And so it was nice to be in a community where I was actually helping the community. And then now I live in Brooklyn. I moved into Brooklyn in January of 2022. And again, I'm in the middle of Bed-Stuy, so I know there's a lot of Healthfirst members that are in my community. Sure. So I took the role in 2019, state programs, the role. And I'd say it's significant accomplishments. One is, do you remember during the Trump administration, there was a rule called the public charge? This was a rule that basically told immigrant populations that they had to choose between getting government programs like Medicaid, housing, food like SNAP benefits, or deportation, either one. And so that was a big rule that impacted many immigrant populations, especially the Haitian community, a ton of Caribbean community, especially in Brooklyn. And so Healthfirst led the charge and education about that rule, because it impacted visa holders, but it did not impact green card holders, permanent residents. But there was a lot of misinformation, a lot of confusion. There was a lot of fraud. Lawyers were trying to charge immigrants to tell them what to do. And so we really wanted to make sure we blasted in the community true education around what we were doing, so that the immigrants wouldn't disenroll from their coverage because they were scared of getting kicked out of the country. So I enjoyed that project. We helped a lot of people get the coverage that they need, and it helped us grow this, our product and our membership. I think another awesome feat, which I couldn't have done without a team at Healthfirst, and in my team alone, I work with 555 other employees that we call trailblazers, and then Healthfirst as a whole has 5,000 employees. And so these are my colleagues. And one of the biggest feats that we had was during COVID. We did so much to try to help our members navigate the craziness of COVID. We booked appointments for them. We helped them get transportation to get vaccinations. We booked appointments for them on the website, because the websites were confusing and they were in English only. So it was very hard for Caribbean populations to book their own appointments. We did community education. So there was lots of fake news around what's in the vaccine, should they get the vaccine? And we did a lot of myth busting to make sure people knew the right information. You can decide not to get the vaccine, but you should have the facts. You shouldn't make the decision based on the wrong facts. So we did a lot of community education. We also did an amazing campaign with City Harvest, where we found food deserts. So these are parts of New York City where there wasn't a lot of access to healthy food. And we worked with City Harvest to bring food pantries to those food deserts so that our members could get food, because that was one of the biggest issues that we heard from our members, was that there was an inability to get food during the pandemic as well. So that was also,
Yeah.
I don't think I knew this even model existed. So no, I had no idea.
Yeah.
I didn't know I wanted to be in health insurance. I stumbled into health insurance accidentally. I was actually working in, and don't laugh, I was working in a warehouse of a beauty supply store. And that's where I was working. And I met a woman who happened to be the chief operating officer of an insurance company. She asked me for my resume. I gave her my resume, and that's how I got my first internship into health insurance. So getting into health insurance was totally accidental, because I would have maybe still to this day been stacking bottles on a shampoo bottles on the shelf, right, at the warehouse. So I stumbled into healthcare, but then I found out I loved it. And then I connected my own story with my tooth to what I could do to try to bring healthcare to other people, especially people that look like me. And I knew when my parents came to America, English wasn't their first language. They were nervous. Even when you see a doctor, you might feel that you're getting judged by a doctor that doesn't look like you, or that doesn't speak your language, or doesn't understand your culture. And so that was near and dear to me, that there's so many New Yorkers that have pain, feel sick, and they are going to have an appointment with a doctor, and they're looking at the doctor and they don't think that that doctor will actually care about how they're feeling, or they might not believe them. There's this concept called implicit bias, and it's a concept that talks about how, because of racism, discrimination, and bias, sometimes there's perceptions that people have about you before they even meet you. And this is why a lot of Black women find it hard to get care when they have childbirth. And that's why the maternity mortality rate is so high. And the example is, someone might say, on a scale from 1 to 10, what's your pain? And a Black person will say, it's a 10. But then the healthcare community doesn't believe them. They're like, oh, they're just trying to get drugs. They're just trying to get Oxycontin. So don't believe them. It's not at a 10. Or, oh, they look tough. Black people are tough. They're in sports. They're strong. They have big bones. They're not really in pain. They can handle the pain. And those are implicit biases that can impact health. And so I really wanted to focus on that too, and make sure that the doctors that service our members are aware culturally competent, listen to our members, understand our cultures, and that our members can get access to doctors that really care about them. Everyone was scared to go outside. I think our team was so brave because around September of 2021, we started to go back into the community. Now, I know every day in our community, there were Caribbean New Yorkers that were going to work every day. They never got to work from home. I was privileged, right, to be able to work from home. But there were workers that had to go to the restaurants every day, had to go to the grocery stores every day, had to go to the doctor's office every day working. But our team went back into the community in September 2021. We opened up our community offices. We have 25 of them. And we were so happy to tell the community we're back. And so I think since the pandemic happened, our team is so much more fervent and passionate about healthcare, because during the pandemic, many people that were sick didn't go to the doctor because they didn't want to get COVID. So I'm not going to the hospital, I'll get sick. So instead of getting care, they stayed home and they haven't seen a doctor in a while. And so I think the big change we're seeing in the community is trying to convince them it's safe to come back out to see their doctor. Things that you haven't done maybe in 2-3 years: annual checkup, cancer screening, checking out your blood work, A1C, your sugar levels. Those are the things we need to get the community to do again, because for maybe 2 or 3 years, they haven't done it because there was fear. I think the number one challenge is engagement. I understand the population we serve. We serve a community that maybe they just came to America. They were put on a bus from Texas, driven to Port Authority, and they're coming off the bus. And Healthfirst works with New York City to give those new New Yorkers, because now they're new immigrants, toothpaste and deodorant, so they have a little bit of dignity when they get off the bus after this long trip. Could you imagine thinking about healthcare when you just landed in a brand new city? And these are Haitian brethren, these are Mexican brethren, these are Guatemalan brethren. These are all brothers and sisters that are just like us. They bleed like us. They just happen to be in a country that's under turmoil. And so it's hard to engage that person because they're worried about housing, food, education for their kids first, before they can even think about insurance and seeing their doctor. And so those are some of the struggles that we have, trying to keep it in the forefront of people's minds that health is your wealth. We also enroll, the grandmother she's a Jamaican grandmother in Brooklyn. She's on a 5th floor walk up, and she sometimes, if her knee hurts, she doesn't want to go downstairs to get a medication. So then we're thinking, like, what can we do to have the medication delivered to her apartment rather than having her go down the steps on a rainy day when it was flooding last week, for example, to get the medication at the pharmacy. So we think about where our members are, and we try to meet our members where they are. We do that through our mobile app, because it's in different languages. We do that through the people we hire, so that the people we hire look like the community we serve. But that engagement piece is the toughest part, and doing it in language and doing it culturally competent.